I'm honored to have with me here Dr. Patrick Mallucci from London. Dr. Patrick Mallucci, or Pat, is probably maybe the most famous breast surgeon currently in Europe, especially in England. And he's the inventor of the ICE principle. And it's a real honor, first of all, for you to come in Israel, especially in these troubled COVID times. How's COVID, by the way, in England right now?
Yeah, well, first of all, what a pleasure to be here, and thank you so much for having me. COVID in England at the moment is pretty good. We're quite lucky in that we don't have a lot of these restrictions that you guys have. So we're not even used to wearing masks anymore.
Really?
Yeah.
Oh my God.
So in July, the government announced end of lockdown, and it's remained like that since then. So we're pretty lucky.
Okay.
Yeah.
I'm coming to you next week, so hopefully that's fun.
Come without your mask.
Okay, so where do you practice plastic surgery?
So I practice in London, and my practice, as you will see, I have an OR facility in my practice, which is a facility for doing day case sedation procedures. So about 70% of what we do is done under sedation.
Yes.
And the other 30% is done under general anesthetic in the private hospital.
Okay.
But the real game changer for me has been sedation in the last...
Sedation and local anesthesia?
Yeah, it's unbelievable. And we were reminiscing the other day about breast augmentation, simple procedure.
Yeah.
10 years ago, our standard procedure was patients would be admitted to the hospital, they'd have a general anesthetic, we would use drains, they would stay overnight, and they would go home the next morning. Today, that same procedure is carried out under sedation. About an hour after the procedure, patients are dressed and they walk home. There are no drains, they carry on with their lives. And we were just thinking how things have changed.
Amazing.
So it really has been a dramatic change in my practice.
So what's your day-to-day kind of bread and butter procedures? Do you do only breast cases, or do you do other things as well?
You know, I'm known for my breast surgery, as you know. And so, you know, probably about 85% of what I do is breast.
Okay.
But I do, I mean, and with breast, I also include body, because liposuction, tummy tucks, that all goes with the same territory.
I agree.
But I will do, I do some facelifting, I do some eyelid procedures. And really these are in patients that, I don't go looking for those patients. They're patients who know me and they don't want to go elsewhere. I enjoy it. It's a break from breast surgery. I like doing it.
So you're most known for breast and the ICE principle, but what's your favorite surgery to perform?
I mean, I think the favorite surgery, I mean, it's difficult, isn't it? Favorite surgery is getting a nice result, whatever you do. Okay. That's your favorite surgery. I think probably what I enjoy most now at this stage in my career are the difficult revisions that get passed to me.
Secondary cases, tertiary?
So these are the people who've had lots of procedures, they've had no luck, and I'm the last port of call. So that's a big challenge. And if I can make those patients better, that's a big satisfaction.
So coming up as a resident in plastic surgery, who did you look up to, you know, when growing up and you said, okay, I want to be like them?
It's a really good question, because I would say not many people. I think as residents, we're often poorly taught. And I think when I was in a residence, we didn't have the education that was around today. We didn't have the speakers that, you know, that are so readily available in all of these meetings. So we were poorly educated. So I think a lot of what I did was self-taught. As a junior consultant, junior attending, you know, I have to say I admired Per a lot. And Per was somebody who I thought, you know, had really, you know, given thought to what he was doing, and you know, trying to apply, you know, both science and art at the same time. And I think it was people like Per, like Scott Spear, you know, Pat Maxwell, who really stimulated me to want to be better.
Okay, and where did you do your fellowship, by the way?
So I actually did I went to Australia.
Okay.
And I did a microsurgery fellowship.
Ah,
And it was mostly in head and neck surgery.
interesting.
And it was a fantastic time. And then when I came back to London, I was appointed at University College London Hospital. They didn't have a breast unit. And the chief of surgery said, I want to start a breast unit. So I want you to go and learn some breast surgery. So I went off to Paris for 3 months, just to kind of, okay, better realign my focus here.
Yeah.
And that's how I fell into breast.
Amazing.
Yeah.
Okay. You're now considered kind of a key opinion leader in terms of breast surgery, implants, and so forth. What can you tell for like our residents who are maybe thinking, maybe I want to be the next Pat Mallucci? I know there's no kind of one-size-fits-all advice, but is there a kind of a principle that you can advise them?
Yeah, and it's a tough question, isn't it?
I know.
Because we all get there through very different routes. I would say, look, you know, start life simply. Do things simple. You know, be humble. Don't be arrogant. You're not as good as you think you are.
No.
None of us are.
Oh.
Not even today.
Yes.
I get bad results today. We all do.
Thank you for saying that.
You know, and I think that never changes throughout your life. Yes, you have more experience, you get better, but nothing is. So I think that's a very, you know, safe principle is know that you can do better, you know. And I think every case I do today and every post-op, I always think, yeah, probably could have been a bit better.
Yeah, I always look up to Radu because he has all the best results, but soon we'll talk to him. A few quick questions.
We won't talk about the vote.
We won't talk about the vote. But it doesn't matter.
It's Radu.
It's Radu, it is. So, few quick questions.
Yeah.
What kind of music do you listen to in the OR?
I like hip hop.
Really?
Rock, yeah.
American hip hop?
Yeah. Very much influenced by my kids. I have an 18-year-old daughter, 21-year-old son, and they've always got me really involved in their music. And yeah, that's what I like. Yeah.
What do you have as an interesting hobby, if you have time?
Yeah, I play soccer.
Really?
Yeah, I'm obsessed with soccer. Yeah, I'm a failed footballer.
You're Brit and also Italian, so it's both, huh?
Yeah, so I play twice a week.
What's your favorite food?
Pasta.
Pasta?
Yeah.
Okay. Any sort of special pasta?
Yeah, I do a lot of good, but probably one of my favorites is something called la puttanesca.
La puttanesca.
Yeah.
Ah, I love la puttanesca. Okay.
So it's one of my favorites, yeah.
Perfect. And last thing, what's the country you love the most?
Italy.
Italy?
Easy.
Where in?
Look, I'm from central Italy, from Umbria.
Umbria, I love Umbria. Perugia?
Just north of Perugia.
Where? Gubbio?
No, it's further north.
Todi?
Città di Castello.
Città di Castello.
Yeah.
Okay.
So that, but my grandparents also moved to Rome, so Rome is my second city. So moving between those two. And I also studied for nearly 2 years in Napoli.
Okay.
Which I'm in love with. Yeah.
It's crazy there.
Yeah.
Gamora and stuff.
Yeah.
But
what a place.
What a place.
Yeah.
Thank you very much for giving me your time and for coming to Israel, especially in these COVID times. And hopefully from now we're going to have some fun. Because you missed yesterday and Radu got completely drunk.
I'm counting on it.
Okay. And we talked about things that I cannot say.
Yeah.
Right, Radu?
All right.